been struggling with your weight, maybe your sleep is disrupted and your moods are not where they should be, you're not feeling chipper all the time, well, maybe it's time for a dopamine detox. And I'm sharing today some symptoms of low dopamine that you may not have been related to what's going on with your brain chemistry. And dopamine, we know, is a neurotransmitter, really important for our pleasure and reward centers in the brain. But when we're low in dopamine, we can have some chronic issues and symptoms. So one of those symptoms of low dopamine is chronic back pain, as well as abnormalities with our bowel movements. So persistent constipation can be related to low dopamine as well. We could have difficulty swallowing and sleep disorders. So feeling fatigued the next day because you've had a not so great sleep the night before with insomnia, some tossing and turning, can be related to your low dopamine levels as well. Attention difficulties can be another symptom of low dopamine, meaning that whether it's ADD, ADHD, just having difficulty staying on task and keeping your brain engaged in those activities can be related to your dopamine levels. Reduced sex drive can also be related to low dopamine. Even hallucinations and delusions can also be related to this dopamine reward center. Low moods, as I mentioned earlier as well, and maybe even depression, and fluctuations with your weight. So if you've really had difficulty keeping that weight off or getting it off, it can be related to your low dopamine. So ladies, do all these symptoms sound a little bit familiar when I'm talking to you? Well, yes, a lot of these symptoms can be related to perimenopause and menopause as well, which I find interesting, of course, as a woman, because is it related a lot to my dopamine levels? So that's a question I want you to ask yourself as well. For more information how to do a dopamine detox, check out my video, Dopamine Detox, and the connection between dopamine resistance and weight loss. I'll see you there.